Hello, everyone. Happy Monday, I guess I would say. This week, I would like to talk to you guys about what is the difference between a whole food supplements and vitamins. And that is something that is being asked into our office over and over and over again. And I've had that question many times. And I would like to just touch base on that today. And just to give you an easy example, if I were to ask any one of you out there, would that be better to have an orange or to have a glass of orange juice? What would you say? Of course, you'll have the orange, right? So we know that in the orange, we might not know what's everything that is in it, but we know that it's everything that our body needs. And what we have done in science and in food science is we have a person that is really, really smart that will extract what we think that is good in the orange. For instance, ascorbic acid, and then we're going to put that and we're going to encapsulate that, put that in a bottle, and then we're going to start giving that to people, and we call that vitamin C. So this is just one example, but for the most part, just about any store will be selling some supplements, and that definition of supplements is by nature it is synthetic. And if you look on the back of the supplement bottle and you have this impressive line by line, how much vitamin A and B and ascorbic acid and all of those things, which they are synthetic, right? Versus a whole food supplements, which means that we're having the whole. And when you have the whole, is you have the entire thing, right? It's not just ascorbic acid. Ascorbic acid is one part of vitamin C complex, but you also have some coenzyme and cofactor that goes with that. So the whole food vitamin C complex is better than just having ascorbic acid. As a matter of fact, in the medical literature, there is some paper that tells us that when we give people synthetic vitamin A or synthetic vitamin E or just parts of it, it has some negative effect to the body, of course, because it's hard to do research by giving a pound of carrots to a patient for a whole month or 3 months or 6 months or a year and finding out the effect of whole food vitamin A, what it does to the body. So this being said, to just recap here for a moment, when you have a whole food supplements is the whole, and when you look on the label, you're not going to see a big list of things that you don't know what it says, number one, for most of you out there. And then you're going to see food on the ingredient list like Brussels sprout, alfalfa, green grass, right? So this would be the whole versus synthetic, which there's a bunch of names that you don't know what that is. So I just want to make sure that, at our office, we promote, I am a big fan of having the whole versus just the parts, because we know that in the whole, there's things that we might not know about, but we know that this is what's best for the body, to give the body the raw material so the body knows what to do with it. So in the world of vitamins today, there's 3 different areas that you're going to be hearing from, which most of you probably don't know anything about, is you have whole food, you have food-based, and you have synthetic. So most supplements are synthetic by nature. Some of the company will just promote themselves as food-based. Food-based is we use a little bit of food and then we put synthetic in. And then we have whole food, and a whole food company uses the whole. And then, I would say that some of the times, if you were to call their company, that they would also have a farm, or sometimes they would get it from a third party. So hopefully this is helpful to you. We are always, it's always better to use the whole versus using the parts. So that's the bottom line for today's teaching. So whole food supplements are always better. And this is what, Dr. Jean-Guy is for. We want to give the raw material to the body so the body can do what it was designed to do, so the body can heal itself. So I hope this is helpful to you. We'll talk to you soon. Bye.